Data science do's and don'ts when helping with a pandemic. I'm Tonya Hall, and joining me is Dr. Robert Munro, author and CEO of Machine Learning Consulting. Welcome, Robert.
Thanks, Tonya. It's great to be here.
Welcome back. Give us a brief summary of your background and describe the type of work you do at Machine Learning Consulting.
Hey there. Yeah, I'm a machine learning professional. I've been working as an engineer, scientist, product leader, and executive in various machine learning companies worldwide. So this has taken me from Australia originally, in Europe, where I worked in documented indigenous languages, West Africa, where I worked in post-conflict development for the United Nations, in refugee camps in Sierra Leone and Liberia, and then here to Silicon Valley. I came here to get a PhD at Stanford, where I focused on machine learning applied to healthcare and disaster response. Since then, I've continued to work as a disaster responder, responding to disasters worldwide, like earthquake in Haiti in 2010, floods in Pakistan that year, Hurricane Sandy here in New York, several hurricanes off Florida and neighboring states, as well as a number of different responses during the Arab Spring. Currently helping with COVID-19 as well. And so I've done all of this disaster response work in parallel with being a machine learning professional. So at the same time, I've been an executive at a number of AI startups, and I also ran product for AWS's first natural language processing and machine translation services. And today, I'm CEO of Machine Learning Consulting. So we help large companies adopt machine learning practices, incorporate them into their products in a way where hopefully the consumer doesn't even need to know that they're using machine learning. It's just helping them with whatever jobs that they're trying to get done. And this has covered a variety of areas, including tech companies here, making agriculture smarter and more efficient with computer vision. And I was working in food safety and epidemics around food safety before COVID hit. And since COVID, I've now been working, advising a number of organizations with the response, including some of the major organizations identifying misinformation, and the World Health Organization's response system, where they have a WhatsApp chat that tens of millions of people around the world are using to get information about COVID. So needless to say, this is something that brings together my machine learning and my disaster response background.
I want to talk about COVID-19 and the recent blog post that you wrote, 5 ways data scientists can help respond to COVID-19 and 5 actions to avoid. But before we discuss the list, you mentioned a variety of disasters and situations you've been in. Explain the experience that brought you to these kinds of recommendations.
Yeah, so in a lot of disasters I've responded to, and in most of them, I've seen a lot of people rush in to try and respond, and typically do more harm than good, despite having the best of intentions. Public health and managing infectious diseases and disaster response more broadly is really hard activities. Most of the time, you're working with very limited resources. You have to make decisions really quickly, and it builds on a lot of expertise that you'll get over the years. So as an analogy, if you were to work up to a hospital, having never worked in healthcare before, you shouldn't be offended that you're given a mop and bucket when you're volunteering. You should not be invited in to help with surgery. That the best of intentions aren't going to help there, and you're just going to get in the way and probably do more harm than good. So the same is true when people with the best of intentions, especially data scientists, come in and try to do their own analysis, try to understand what the spread might be. It can create a lot of noise, and it can also focus on the wrong topics. So create a lot of noise around personal protection or distancing, which isn't based on good science. And I find that especially true from people from my background, from machine learning backgrounds, because good epidemiologists that I've worked with in the past are really good at understanding confidence intervals. And most machine learning scientists don't know how to calculate confidence intervals. So it's really important when you're working, especially in epidemics with small amounts of data, that you have statistical rigor and knowledge around the right kind of statistics to apply.
So, what are some of the do's?
Yeah, so there's a lot of ways that people can help, and most of the work that goes into disaster response is not trying to predict the immediate effects of that disaster. So most of the work going into the COVID response right now is not trying to predict what the number of cases is going to be at certain locales. That's certainly important, but most of what we're trying to do is around getting the right information to people about their personal protections, what the symptoms are, at what point should they be contacting their healthcare providers, how can they look after the people around them. And so among all these kinds of other activities, there are a lot that data scientists can do. One of the simplest things is helping the people around you interpret information. So if you're watching this, if you're watching this show, chances are you come from a technical background. You have some good statistical knowledge. You're able to interpret when something might be misinformation. So you can see that there might be a graph, but it's not actually labeled, or it's erroneously mapping two different things to each other. There's a log scale, which changes the interpretation. Or people are trying to interpret evidence from a graph as causation when it's only showing correlation. So these are probably tasks that you have to think about every day in a technical day job, but although your family might not. So for people in your immediate circle, if you can help them understand, okay, like, this is a good graph. This is published by a reputable institution that studies infectious diseases. This is an actual public health official. Then that goes a long way just in itself, just doing that in your home. Among the other things that you can do, if you happen to speak a language other than English, translated information into those languages are important. A lot of, especially scientific publications, only come out in English initially. And English only makes up about 5% of the world's conversations daily. So 95% of the world's conversations are in 7,000 other languages. And for a lot of these, information typically does not get translated into those languages. And this is actually the biggest difference I've seen between this and past disasters that I've responded to. Most of the time, disasters are very localized. It's an earthquake or a conflict or flooding. And we're trying to get a lot of people into one region really, really quickly. And it's hard logistically. There's normally only a handful of languages that we care about. For disasters of COVID size or larger that I've worked with in the last 20 years, this is the best responded to disaster ever, simply because the response is distributed across every healthcare professional in the world. So we're fortunate in that regard. However, because it is spread across the world, it means we have to translate information into probably 3,000 or 4,000 languages to realistically get the right behavior from everyone that we need. So that's super hard. If you're able to help with that, then that's really valuable. So these are things that you can just do in your community. More specific technical things. So if you've ever worked in data analytics or in machine learning, you know that you spend more time preparing the data than doing anything else. And the same is true in epidemiology. So if you haven't worked in epidemiology before, you're probably not going to be able to come up with a good model to predict the spread of disease or how many cases might be detected somewhere. However, you can help prepare that data. So a lot of data that might be published by different hospitals or healthcare providers is going to be in slightly different formats. They'll use slightly different naming conventions for locations. There's still a lot of just kind of grunt work that needs to go into making sure these data sets align with each other and can be used. And so that's something that you can do to help with the response. There's also a lot you can do in analyzing data that is not directly related to the response. So good examples here would be analysis of human behavior and what stress that might put or take away from healthcare systems. So when I was responding to the outbreak of Ebola in West Africa, one of the things we wanted to look at was the impact of people potentially dying from preventable illnesses because they were afraid to go to clinics and hospitals. They thought they might contract Ebola if they went to the clinics. And we worked out that for every person that died from Ebola, 10 more died from preventable illnesses because they weren't attending the clinics. So this was really important information to try and make sure that we were toning down or trying to get the media to tone down a lot of the sensationalist coverage that was being broadcast within the country because it was having just a really terrible net negative effect. And so there's a lot that you can do here, some of it on the positive side. So looking at the impact of the environment now that people are sheltering in place. So one great study looking at the reduction in accidents in, I think it was Seattle, and how that's taking a load off the hospitals so that they can focus more on COVID. There's just a ton of really interesting changes in human behavior right now that you can analyze as a data scientist or even an engineer interested in data science. And there's no downside necessarily to sharing your results, unlike if you're trying to do the equivalent jump into the surgery. And then finally, there's a lot of existing data sets out there from past disasters. So working with a few different data sets combined from disasters that I'd responded to in the past. It's an open source data set. It's been used already by Udacity, Nanodegree for data science. AI for All use it to train school children to be computer scientists. It's also part of a few different courses. It's been used at MIT, Northwestern, and Stanford. So these data sets are out there and open. There are disaster response messages sent in multiple different languages during disasters, and simple things like understanding the content, how that content changes over time. Can we build systems to automatically translate these messages? Can we build systems to automatically find out what's time critical versus not time critical? Any kind of analysis that you do in these past disasters is going to help us as well in the current COVID response. So I strongly encourage anyone who's interested to look at those.
All right, Robert, where can our audience find your post and maybe even get a preview of your book, Human in the Loop, Machine Learning?
Yeah, so my post, 5 ways data scientists can help respond to COVID-19. It's probably easiest to search it. It's on my my Medium page. It was also published by Katie Nuggets. So Katie Nuggets is I think it's the most popular data science blog. And if you're interested in my book, Human in the Loop Machine Learning, where I actually use disaster response data as a worked example throughout, having started that before COVID. You can go to Menin.com. Menin are the publishers for my book. You'll find a free preview of the book there and the ability to purchase electronic or hard copies.
Dr. Robert Munro, author and CEO of Machine Learning Consulting. If somebody wants to connect with you personally, Robert, how can they do that?
If you'd love to connect directly with me, please do. I am happy to connect on LinkedIn, and you can also find me on Twitter at WWRob.
All right, thanks again, Robert.
And thank you, Tonya.
And find more of my interviews right here or at tonyahall.net. Thanks for watching.